I think as a parent, you know when something is not quite right. And we were just experiencing as new parents what those mother and father instincts are. And, you know, when you get a stare back from your child and he is just sort of telling you, but not saying anything like, I'm not well.
Just after his 4-week checkup, he started throwing up after every meal. It was about half an hour after he'd eat, he would projectile vomit all over anyone and anything that was close to him. So of course we were concerned
Very
after
scared.
a couple of days of this. So we felt it was a good idea to check in with a pediatrician to see what was going on with him.
Well, it was interesting. There was actually a few things that happened here. First, he was doing great up until this visit. He was gaining weight, everything was good. When they came in for this visit, they told me he had started vomiting fairly frequently. It was projectile vomiting. He was 5 weeks old. Edward was also born a few weeks premature. He was 37 weeks. And he was also, he was a boy, obviously, and a firstborn male child, and all of these are risk factors for pyloric stenosis. So even though we weren't 100% sure at that point, we had to start thinking about that.
When we took Edward into Dr. Lasser's office, we had no idea how much weight he had lost, and that's where the doctor was most concerned, because he had lost a half pound in just a couple days since his last appointment.
You know, sometimes pyloric stenosis can be caught very early and corrected early, and this was the case with Edward. But sometimes it's not as obvious, and it can go on sometimes for days or even weeks. And these babies can get very dehydrated, and that's a real problem for babies because they can dehydrate quickly. In worst case scenario, babies can get dehydrated and actually go into shock. So it is very important to catch this.
Dr. Lasser said, well, let's change him to hypoallergenic milk, and then if it doesn't stop, if he does not, keep that down, then you should take him to the emergency room.
I think it's wonderful that Howard County General Hospital has a pediatric emergency room, because it really makes me a lot more comfortable referring the pediatric patients there. They have specialized care. The children have problems much different than adults do, and to have somebody who's trained in that taking care of these children, it makes all the difference in the world.
When we arrived at Howard County General Hospital emergency room, they just whisked us back to the pediatric ER right away. Literally, it was just like within seconds. They rushed us back, and we had two fabulous nurses that greeted us and basically started taking off his clothes, taking his vital signs. It was kind of a whirlwind, but everything was happening so quickly. But we knew that, he was in really good hands.
Honestly, I think the most rewarding part of my job is working with the families and the children, because you can see when they come in, they're so frightened. They don't know what to expect. And if you talk to them calmly and you take them step by step through each process, keep them informed and up to date on what changes are going on, you can almost physically see them calming down.
When it came time for his x-rays, the doctors gave me a bottle of milk with barium in it to feed him, and that shows the fluid going down into his stomach, and you could see it just filling up underneath the You could see under the x-ray his stomach just filling up with this fluid and not emptying down into his intestines, and it was just, it had nowhere to go.
Pyloric stenosis is it's a condition that pediatric surgeons take care of quite frequently, although it's not that common. It's an abnormality with a muscle at the end of the stomach, which allows food to leave the stomach after baby eats. It grows too fast. And when the baby eats, the muscle doesn't relax, and whatever the baby has eaten, the formula can't get out of the stomach. So the baby throws up.
So I remember that we were in the hallway. I was sitting on the hospital bed, the rolling bed, with Edward in my arms, and Graham was next to me, and all of a sudden Dr. Sy appeared. We're waiting to go into another test to get an x-ray done, and he said that, you know, all the test results had been going downtown Hopkins, and everyone was talking back and forth about the results, radiology department, the doctors, the surgeons, and they had felt very comfortable with the diagnosis of pyloric stenosis, and said, as a matter of fact, that the doctor, Dr. Stewart, was in the car on his way and would be there within an hour. I basically held it together most of the time, and when they actually took Edward from my arms, that was the one time I lost it, and I started crying, and you know, it was scary, but I knew he was in the best place and that he needed the surgery, and that you know, we wanted a positive outcome, and you know, all the signs were pointing to that he needed this surgery. So we felt comfortable that, you know, doctors had explained everything and they knew what they were doing, and the fact that we had a surgeon from Johns Hopkins downtown come to us, you know, I couldn't have asked for anything more.
It takes about 20 minutes or half an hour. It's a quick operation, and almost immediately the kid feels better, they can eat, and the parents are pleased because they're not throwing up on them anymore. So usually, when you fix it, the baby does well, they stay in the hospital maybe a day. I see them back in my office in a couple of weeks, and their incisions are almost invisible. And oftentimes I never hear from them again because the baby does so well and they don't have any other trouble.
That the surgery, it was so successful that, you know, our child was ready to eat, and then, you know, to actually feed him and it's not coming back in your face is pretty amazing.
It's a great relief.
It's a great relief, and really, you know, you've done the right thing for your child, and you know that the, you know, Howard County General Hospital was the right place. We absolutely think that the staff, the surgeons, the doctors, the nurses, they saved Edward's life. We had had a good experience for his birth, so then we had a great experience for, you know, this, you know, emergency situation. I think if we had to ever return in the future for ourselves or for our child, we would, you know, go back to Howard County General. I mean, it's a fabulous hospital.